Good morning students. Today we will see about the blood supply to the brain. Before we are starting the class, I would like to thank Dr. Nazeeb because most of the neuroanatomy part I am not understanding, but I understood after listening Dr. Nazeeb class. He is a Pakistani doctor, wonderful teacher. I am a follower of him. I love his lecture. Thank you, doctor. Yes, today we will start about the circulatory system of the brain. So the circulatory system of the brain basically we will see in a carotid system anteriorly and vertebrally will be the posterior system. So it is in a two way we have to see. In a cardiac output per minute 5 liter of the blood is circulating. In that 15 to 20% of the blood which is going to the brain. So first we will see how the carotid system is starting, how the vertebral system is starting. The carotid system is really starting from the carotid artery. Carotid artery is the where it is taking origin. It is the arch of aorta. Carotid artery, it is going, this branch is going upward. This is a carotid sinus. In that right and left common carotid artery. And then after this carotid sinus, there is an artery is called external and internal carotid arteries. This is a internal carotid artery it is going. There is a branch, it is called the subclavian branch. These subclavian branch, there is the arteries are taking, this are going upward medially, posteriorly to the heart and reach the spinal cord. So reach the spinal cord. So this artery is really taking its origin from subclavian artery. That's called, the name is called vertebral artery. So this vertebral artery is the posterior. So that's what we are telling, posterior. This one, two circulation we were seeing now. So this is a carotid circulation which is present anteriorly, mainly by the internal carotid artery, and then posteriorly by the vertebral artery. Vertebral artery, where it is taking its origin, it is taking its origin from the subclavian artery. From the subclavian artery, it is taking its origin, moving and medially to the laterally to the posterior side and entering into the foramen to enter into the spinal, where it is origin to the foramina, where it is entering into the foramina and reaching the foramen magnum. It is reaching the foramen magnum. From the foramen magnum, it reaching the subarachnoid space. So actually, this circle of Willis is floating in the subarachnoid space. Okay, first we will see about the vertebral circulation. What is the posterior? Now you understood where this vertebral artery taking its origin from. So it is taking origin from the subclavian artery, going upward and medially, laterally, backside, and it is going to the foramen lacerum, where the spinal cord, it is entering through the spinal cord and it is reaching. So if you could see right and left vertebral artery entering into the foramen magnum. See if you see, this is the foramen magnum entering into it, and in the pontomedullary junction they are joining together and forming the basilar artery. So this is a basilar artery. Then when it is going to just below the midbrain and just above the third cranial nerve, oculomotor nerve, and it is dividing into two parts, and it is making, this namely is called the right posterior coronary artery and the left posterior cerebral artery. So right posterior cerebral artery and the left posterior cerebral artery. So now you might have understood, this is taking from the origin from the subclavian artery and entering into the foramen magnum and reaching the subarachnoid space. In a pontomedullary junction, they are uniting together, joining together and dividing just under the midbrain, just above the oculomotor, third cranial nerve, and dividing into two branches, that is called the, I will show you this picture. This will be little bit clear. So this will be right and left posterior cerebral artery. So this is about the vertebral artery. It is going. If you could see, just above this deep, there is a vertebral this arteries just below this vertebral artery. There is a two arteries are joining together and coming down. This is called anterior spinal arteries. So this is all anterior spinal artery. From you see the under surface of the cerebellum, there is a artery. It is originating. It is called the posterior inferior. This is under surface. So it is called posterior inferior cerebral artery, which is also supplying the lateral part of the under surface of the cerebellum and also to the some portion of the medulla it is supplying. And above in the near the basilar artery under the surface, there is just above there is a one artery. It's supplying the both side. That is called this posterior cerebral artery, otherwise inferior cerebral artery. It is called pica. It is called pica. Just above there is an artery which is supplying the under surface of the cerebellum. It is anterior side. It is called the ICA, anterior inferior cerebral artery. This also anterior inferior cerebral artery also supplying some portions of the pons. And in the basilar artery, there is a middle. There is a one artery in a lateral side. It is going. This is called labyrinthine artery. It is 7th and 8th cranial nerve. It is supplying to the ear. It is called the labyrinthine artery. If you see the superior surface of the cerebellum, there is an artery which is originating just below the oculomotor, 3rd cranial nerve. The artery which is supplying the superior portion. So this artery is called the superior cerebellar artery. Superior cerebellar artery. It is mostly supplying to the parts and the lateral side of the pons also it is been supplying. Understand? Now you understood this one. Next, if you see in this spinal artery, there are three important arteries are giving the nourishing this, giving a most nutritious this one to this spinal artery. What are all those artery? This artery, this portion is called the many branches of deep cervical arteries. Then will be intercostal arteries and the lumbar arteries. These all together, these all called the segmental artery. This most important artery supplying the high blood flow to the spinal cord. This dotted line in the both side of the anterior spinal cord, it is called the posterior spinal artery. So hope you have understand where it is taking. This artery is vertebral artery, where it is taking its origin, and in the pontomedullary junction its name is basilar artery. This basilar artery under the midbrain above the oculomotor, 3rd cranial nerve, it divides into two branches, right and left posterior cerebral arteries, right? And then in the branches just about these, the arteries are two arteries are joining together and coming down. This namely is called the anterior spinal arteries. And just above that and under the surface of the cerebellum, there is a posterior inferior cerebral artery which is supplying. This namely is called the pica. And under just above, this also supplying to the medulla, and the lateral part of this one also, the lateral part of the medulla also, middle part of the medulla also it is supplying. And then ICA, anterior inferior cerebral arteries. And then in the middle of the basilar artery, there is a medially laterally one long arteries which is going, that is called labyrinthine artery, 7th and 8th cranial nerve. And then under the oculomotor nerve, there is a one artery is supplying the superior side. It is called the superior cerebellar artery. Okay, hope you have understood. Next we will go to the carotid system of the this one, where the carotid artery it is originating. This one we have told that vertebral artery going to the foramen magnum. Same way, we already told you the internal carotid artery. Internal carotid artery, it is taking into, we know where it is taking into its origin, and the anterior carotid carotid sinus, and it is moving upward and entering into the foramen lacerum. Understand? Yeah, going to the foramen lacerum, and it is going to the middle cranial cavity above the hypothalamus. To this, it is taking its origin, and it is a whole head. You can see this. You could see this is the vertebral artery. Now we have seen it is entering into the foramen magnum, joining to the basilar artery, pica, ica, labyrinthine artery. It is supplying. Understand? So all these are under all this circle of Willis present in the subarachnoid space. Understood? There is like biamater. You know what is dura mater, arachnoid mater, biamater. There is a subarachnoid space where the cerebrospinal fluid, it is floating into the cerebrospinal fluid. Understand? So now it is taking this one, it is in the both above the area where it is in the cerebral hemisphere. It is entering into the middle cranial cavities, sphenoid process of middle center part of the cranial cavity. Now you could see this internal carotid artery. This is just moving forward in both the side. So anteriorly, it is called the anterior cerebral artery. Understand? Then it is coming down, and laterally it is moving the lateral side. So it is called the middle cerebral artery. So right and left both are there. When these anterior cerebral arteries are connected with, these arteries are connecting with each other, it is called anterior communicating arteries. Understand? Then this middle cerebral artery, this one branch is coming laterally, posteriorly, and it is connecting to the right posterior cerebral artery and left posterior cerebral artery. It is connecting together. It is called the posterior communicating artery. Right and left posterior communicating artery. So this anterior cerebral artery connecting together is anterior communicating artery. Then posteriorly, this posterior cerebral artery and anterior cerebral artery, middle artery backside, it is connecting. It's called posterior communicating. So anterior communicating, posterior communicating are connecting together. This one form a circle. It is called the circle of Willis. Understand? This is called the circle of Willis. This circle of Willis, this is the collateral system of the brain. Any blockage in the anterior cerebral artery, it will be corrected by the posterior cerebral artery. Collateral system, they are telling that it is seen in the, especially in the brain and the soul, we could be able to see the collateral system. So the blockage will be prevented. Understand? So this is about the blood circulation of the brain. So you can very well draw the picture of very simple diagram. You can draw like how you can draw about the midbrain, like that you can draw midbrain and pons, medulla oblongata. You can draw like this, and very easily you could be able to draw the arteries where this is, draw the spinal cord and draw the artery where it is going, and other anterior spinal artery you draw the pica, ica, and when these arteries are joining in the medulla junction and it is going, it is a third ocular motor now. Understand? And there is a middle, it is going to the labyrinthine artery. This is pica, this is ica, you can mark it, and under the third ocular, this is a superior cerebellar artery. And about the carotid system, you can very well draw about the carotid system where it is anterior cerebral artery, this is anterior communicating artery, this is lateral cerebral artery, and it is connecting with each other posterior. This part is called really the circle of Willis. So always you have to remember about blood supply of the brain. Nearly in the carotid system, 15 to 20% of the blood supplying to the brain. In a two-way it is supplying. Anteriorly it is a carotid system, and vertebrally posterior. Anteriorly carotid system and posteriorly. But both of them are taking, it is origin from the heart, and it is taking the from the subclavian artery, and it is going medially and it is going laterally back posterior side, so it is entering into the vertebral spinal cord, right, and entering into the cranial cavity. Here will be entering into the foramen lacerum, sphenoid process, carotid cavity, above the hypothalamus it is going. So you have to remember these two system of blood supply to the brain, and this CSF, all this blood supply, all the arteries are floating in the cerebrospinal fluid. So it is a very important question. Often it is been asked. So any damage or anything in a CSF fluid, doctors will be doing a lumbar puncture, isn't it? Lumbar area, where there will be taken for the fluid in a diagnostic purposes, and to study about any problem in the brain or the meninges of the brain. So at least nurses, you should remember how this blood supply are being. It was very well explained by Dr. Nasif. Thank you, doctor, once again. Thank you.